Well, hi, my name's Carrie Hoarty. I'm from Omaha, Nebraska, and I did my medical school training at University of Nebraska Medical Center, followed by a combined Med-Peds program residency, and then I went on to do a geriatrics fellowship here at UNMC. I went into medicine because I was looking forward to the long-standing relationships with patients, but also the intellectual challenge of figuring out what is going on with the patient. I enjoy lifelong learning, so internal medicine is a great fit for me because I get to have relationships that last many years with patients, but also I get to collaborate with specialists in getting to the bottom of what's going on with a patient, and then working to maximize quality of life and health of patients. So I particularly enjoy taking care of geriatric patients, so people who are 65 and older who may be suffering from memory impairment or mobility issues. I especially enjoy working with families and caregivers, especially when there's tough decisions to be made. I always take the approach of trying to minimize medications and the side effects that might be caused by medications, and then helping people meet their goals. Another patient population that I really love, and the fact that I have internal medicine and pediatrics background really helps me in this area, is developmental disabilities or people who have suffered from childhood illnesses such as cancer. I really enjoy, again, working with the families and people who have Down syndrome or autism. I really enjoy working with those patients who are graduating from pediatrics and they're looking for an internist who may understand their developmental issues that we need to address. So when I first meet a patient, I like to sit down with them and get to know them a little bit. What's important to them? Who's important to them? Is it their dog? Is it their husband? Is it their grandkids? What's going on in their life that may be impacting their health, whether it be financial limitations or their work or anything. And that helps us know what the priorities are of the patient. And then I kind of make an agenda. What do you want to talk about today? Is this a healthcare maintenance visit, or are we addressing some certain problems that are bothering you? And we'll kind of map out a plan of what are your goals for your health, and we'll address those things. I've practiced in other institutions, which have been great experiences for me, but I appreciate being at UNMC because there is such a focus on patient safety and collaboration. Also providing evidence-based medicine, but that's also tailored to the patient's desires for their own health. I feel like being in this academic institution allows me to continue to develop intellectually, and as a provider, I can be around really smart providers who humble me every day. But also I can work with learners, such as medical students and residents, so that I can pass on what I've learned in the last 10 years of practice.